I'm Nancy Nielsen. I'm an internist from Buffalo and an infectious disease specialist as well, and I am immediate past president of the AMA. 1,000 adults in America were asked what were their specific questions about seasonal flu and the vaccine. And they reported the following as their questions. How do I keep from getting flu? How effective is the seasonal flu vaccine? How serious is flu? How many people die from it? How easily does it spread? And when's the best time to get vaccinated? Now, you've already heard the answers to all of those questions, and I'm not going to reiterate those answers. But what I'd like to talk about is the role of physicians and other healthcare providers in dealing with this influenza outbreak that we have every year, and this year is expected to be different because we will have we already have the two strains, and there may be more circulating within our country. Seasonal flu vaccine is a personal health priority, and it's a public health priority. And as I talk to physicians, I try to say public health is every physician's second specialty. This year, it's going to become very important for physicians in every specialty, not just primary care physicians, but cardiologists, obstetricians. You've already heard that pregnant women are at risk of the novel H1N1 flu virus. All physicians are going to be necessarily involved in helping their patients make sure they're protected. But there's another thing that healthcare workers can do, particularly physicians, and I appeal to physicians, and that is if we do not get vaccinated ourselves, we are not taking care not only of ourselves, but of our patients and our loved ones. Let me address another issue. That is, in my city, Buffalo, we have had 2 children die of H1N1 flu. It is a great tragedy, but you've heard that kids also die from the seasonal flu. We need to think about this in terms of the human tragedy to a family, to a community, not just of children, but of the elderly. And let me just use a phrase currently operating in the political environment. And with a little twist on that, let me just say that the best way that our country could act to avoid killing Granny would be to give flu vaccine to Granny. And I guess I would end by saying that my medical students take an oath when they first start medical school, at the beginning of their 3rd year, and at graduation. And part of that oath says, prevention is preferable to cure. Indeed it is. For all of us, we need to take this seriously.